LAMP started back in 1996 with the mission of breaking down barriers of communications. We basically do language interpreting and translations, but we have recently incorporated sign language as well. The whole idea was to bring the people together and for all the voices to be heard.
One of the things that I do is interpret at health events. For example, a family will come in that speaks Spanish, and if they need help going around the health fair or health event, we'll walk around with them and interpret whatever they need. They'll also do health evaluations, so any kind of medical interviews that they might have, we're there to help out whenever they're needed.
You knew his first name.
Ese es el área del lenguaje, él supo su nombre,
Not his last.
pero no el apellido.
Knew his age, and if that he was a boy.
También supo su edad y que era un niño.
Didn't quite know his birthday yet. He's little for that.
Todavía no sabía su cumpleaños. I feel like my job is really helpful in the community because I'm using language, which comes easy to me, and I help people go through these simple tasks that we take for granted sometimes. You know, just going to a doctor or dentist is an easy thing, but people that don't speak the language, it becomes complicated.
He usado los servicios de LAMP, hasta ahorita me parecen muy buenos, me han servido para muchos servicios como citas dentales, citas pediátricas y citas para mí.
Today is our first day of orientation, so you're going to learn all about the rules and regulations and how to become a better interpreter.
I train all of our new hires with their initial orientation to the organization. So we go through all of the new compliance trainings such as fraud, waste, and abuse, HIPAA, Protecting God's Children, which is a child abuse awareness training, and then kind of an introduction to interpreting in general for those who don't have as much experience when they start with us.
Confidentiality is of utmost importance as a medical interpreter, particularly because not only is it a law with the HIPAA regulations, but also we need to have the trust of our patients and of our providers to do a good job and to keep that private health information private.
They go through all of the required trainings that we have, including our orientation. Most have also gone through our Bridging the Gap Medical Interpreters Training Program.
I am nationally certified to provide different trainings for interpreters. One of them is called Bridging the Gap, which trains interpreters to become proficient in the medical environment. The next one is diversity training, which will help different communities to work with a diverse group, meaning people from different origins, different races, different faiths.
All of the training that I've received really has helped me to learn the terminology for different settings. For example, mental health has completely different terminology from just a regular medical visit. And it's helped me expand my knowledge of what I need to know because every interpreting session that I go to has a different term that I'm going to learn. So it's really helped me grow and just expand my horizon on what I could be capable of doing in the interpreting world.
We are focusing into extending our services to different corners in the state of Missouri and some neighboring states as well by partnering with health services that reach out to those communities. LAMP is always looking forward to reach out to your community. If you need to talk to us, please do not hesitate and call us at 314-842-0062 and just mention your language. That will be enough for us to help you out immediately. Or you can visit us on the web at lampinterpreters.org.